Farrah Evans began using heroin on the west side of Chicago 20 years ago, long before opioids became the stuff of suburban nightmares and presidential speeches. At first it was nothing more than a party drug, one that was available on every corner in her neighborhood. But soon enough, it consumed her life. "It was crazy," she said. "I didn't realize how heavy that monkey on my back was until I found myself out in the streets, homeless, having to hustle or do whatever I needed to do to get me some heroin." Evans, now 40 and in recovery, embodies a side of the opioid crisis some experts believe has been overlooked by the media and policymakers, African Americans in urban neighborhoods. The Chicago Urban League recently issued a paper titled "Whitewashed: The African American Opioid Epidemic," outlining the drug's toll on that community. African Americans make up 15% of the state's population but account for 24% of opioid-related deaths. At the same time, the researchers said, African Americans are less likely to get help because Cook County, home to about 2 out of 3 Black Illinoisans, has a relative scarcity of clinics providing buprenorphine, the medication many experts believe is among the most effective treatments. Stephanie Schmitz-Bechtoler, a co-author of the report, said those grim facts have been missing from the public deliberation over heroin, which often focuses on white users in suburban and rural areas. On the one hand, the change in narrative has brought a broader awareness to the issue, but it has come at the expense of the comprehensive set of people who are affected by this, she said. Illegal drugs have been a part of Chicago since the opium dens of the 19th century, and the heroin market in particular has long been robust. A 1925 Tribune report quoted a federal investigator as saying, "Chicago has been the source of supply for the entire country. All the big men in the dope industry, it's nothing less, make their headquarters here." While newspapers were crammed with lurid stories of dope fiends and jive pushers in crumbling city neighborhoods, the suburbs were seen as relatively free of the drug's curse. But that started to change in the 1990s, when the arrival of heroin pure enough to snort spawned a new breed of user, young, affluent and white. The demographics shifted even more as a surge of powerful opioid painkillers led many more into addiction and overdose. Opioid deaths among whites, 70% of the nation's total in 1999, grew to 82% by 2015, according to figures from the Kaiser Family Foundation. Many who died were from wealthy suburbs and far-flung rural areas, places that had never before encountered such a plague. News coverage reflected that shift, but in a way that cast white users as sympathetic victims and Black and Latino users as criminals, according to a media analysis published last year in the journal Culture, Medicine and Psychiatry. While the suburbs have reacted to spiraling opioid abuse with law enforcement policies that aim to guide users into treatment instead of jail, the Urban League researchers said the hard-nosed war on drugs approach remains the rule in Chicago's poor neighborhoods. From 2012 to 2016, the Chicago community areas with the highest rates of felony drug arrests were overwhelmingly the city's racially concentrated areas of poverty. The neighborhoods with the lowest rates were primarily white and wealthy, they wrote.